This is the anatomy video for the knee and lower leg. As usual, we're going to start with articulations. In the knee, we have three bones. We have the femur, which comes down to the medial and lateral epicondyles, and those meet with the tibia and the medial and lateral condyles. The patella then sits on top. The other joint we have here is the superior tib-fib joint, which is where the fibula comes up and meets the tibia. And this can be a source of injury as well. So A is the view from the front, and B is the view from the back. You can see from this top picture that there are ligaments in the knee are quite dense, and they actually provide the majority of the stability to the knee joint. This is from the back side or from the posterior side. So we have the MCL here, or the medial collateral ligament. The LCL is here, or the lateral collateral ligament. And in the middle, we have the two cruciate ligaments. We have the ACL, which is the anterior collateral ligament. That runs from the back of the femur to the front of the tibia. So this is going to prevent your tibia from moving too far forward. Then we have the PCL ligament, or posterior cruciate ligament, which runs from the front of the femur to the back of the tibia. So this is going to prevent your tibia from moving too far backwards or from your femur moving too far forwards. The other thing we have in the knee are meniscus. This is a view from the top of the right knee. So we have the medial meniscus here. You can see that it's a C shape and it's generally thicker. We also have the lateral meniscus here, which is more almost a circle. Okay. You can see how the cruciate ligaments set up next to the meniscus. The other thing I want you to notice is that although this red line isn't right on top, notice that that's the blood flow, and there's very little blood flow to the inside of these circles. So when you get damage there, it's harder for that to heal. The blood and nerve supply. The main nerve on the posterior side of the leg is the sciatic nerve. It's generally the size of your thumb. It runs all the way down to just above the knee, and then it is going to divide to the tibial nerve. It runs down in beside the tibia, and the common peroneal nerve, which is going to run down the lateral side of your leg. On the front side, we have the femoral nerve, which is going to come down through the quads. We have the blood supply, arteries in red, veins in purple. Again, I'm not going to test you on the individual names and where they are. It's more that you have an idea if there's an injury that occurs of veins, nerves, or arteries that could be damaged. When it comes to muscles, we're not going to look at the hip because we'll cover that next week, so we're just going to stick with the thigh. In the anterior thigh, we have the quad group. Okay? So we have rectus femoris right at the front in the middle. We have VMO, or vastus medialis, here, and vastus lateralis at the side. Then the IT band runs all the way down the side. Under rectus femoris here, you have vastus intermedialis. The other group we have is the adductor group. So these are generally divided by sartorius, which is this twisting muscle here. And the adductor group is here. So if anybody gets a groin tear or groin pull, these are the muscles that are affected here. On the back side, the main group we have is the hamstrings. So on the medial side, we have semitendinosus and membranosus. And on the lateral side or the outside, we have bicep femoris, which has two heads, the short head and the long head. The thing to remember is that these muscles actually cross the back of the knee. So the hamstrings come all the way down and actually insert below the knee. This is the gastrocnemius, the calf muscle. It actually comes up and inserts above the knee. So there are muscles behind your knee. And if we cut these away, you can actually see there are two muscles that are located behind your knee. You have the plantaris muscle here, and then right underneath it, running in a diagonal fashion here, you have the popliteus muscle. Movements at the knee, we have knee flexion, where we bend the knee extension coupled with hyperextension, where we straighten it. And there are two others, which are medial tibial rotation and lateral tibial rotation. And we'll get into those in the lab so that you can see them. There's two other things to mention. First is the kinetic chain. The kinetic chain is important when it comes to exercises. We have two types of kinetic chain exercises. Closed, which is where the foot is in contact with the ground or an object, and open, where it's not in contact with anything, so the leg is free floating. And the thing to remember is that the knee is honestly the weakest link when it comes to the joints of the leg. So if you have a breakdown in the system because of the forces and that the body can't handle those, the knee is oftentimes where you will see the injuries. The other thing to mention is the screw home mechanism. So this happens when we straighten and hyperextend the leg. Vastus medialis is the muscle that straightens and hyperextends the leg. It does the last 30 degrees of extension, so it takes us into that extension and hyperextension position. Popliteus is the muscle that unlocks that. So it's the muscle that crosses at the back of the knee that unlocks the leg from being in that completely straightened position. So if you can hyperextend your legs and you feel kind of a little pop or a jerk when you come out of that position, that's the popliteus unlocking the leg from being in that position.